Delaware is a place where you really can make a difference.
We all collaborate with each other to provide the best service for the patient.
Delaware really offers graduate nurses kind of a buffet menu of opportunities.
I always wanted to be someone's doctor, and I felt like a place like this is where you could do that.
This gave me a great opportunity to be here and get my permanent residency.
Medical practice in Delaware is a practice made perfect. Whether your interests are to start a practice or join an established organization, for health professionals across the board, Delaware is a great place to locate.
I find myself working with people here, groups of medical professionals, groups of public health professionals, groups of education professionals and other professionals that all are very willing to come to the table together and collaborate in the best interest of the people that we all serve.
Working in the mental health community in Delaware is a very unique experience. No problem talking with the medical community and making sure that we're all referring in an appropriate way and working together to try to give these families what they certainly deserve, which is the highest quality of care.
Whether you're in an acute care setting, a community-based setting, education setting, a prison, there is a lot of opportunity in Delaware that you don't necessarily get in the big states. I've lived in large states, but you don't have your ability to really put your hands in, roll your sleeves up, and to be at the steering wheel. A lot of times you'd be kind of in the back of the bus, so to say. Here you're driving things.
In a very short period of time, I was able to move from being an outpatient clinician to now managing the whole downstate operation for a large child-serving organization. I'm not so sure that I would have had that opportunity or those kind of opportunities elsewhere.
We have 8 hospitals, and all of these hospitals have their own strengths.
There had never been a problem communicating with other physicians.
If we need to refer for any kind of specialty that we're not able to offer for that, they're open to receive them.
Nurses really can practice at a full level of autonomy. Our nurse practitioners were some of the first in the nation to have prescriptive authority, and our nurse anesthetist and others really are leaders in the nation.
The Delaware Health Information Network is the first live statewide health information network in the nation. All of Delaware's acute care hospitals and 92% of medical providers use the network to share patient medical information safely and confidentially.
So when we want to pick up a MRI report or any lab report, we can go into DIN and we can pick it up.
Delaware is also a wonderful state in which to live. Whether you prefer city life, scenic coastlines, or small-town charm, Delaware offers a wide range of community settings and housing prices below the national average.
I have truly felt supported in my time of raising a young family here and being able to attain that work-life balance, being able to shut things off on weekends in which I'm not working.
The amenities of living here, first of all, is tax-free shopping. Also, the schools, the activities for children that are safe is a factor for me. And the accessibility to New York, DC, the shore, and a lot of cultural activities.
I've lived in Delaware for 8 years, and even though it is such a small state, I'm still exploring, and it's just unlimited, the different kinds of things there are to do.
The cost of living is low for a beginner physician, and it's easier to bring up a young family here to get started. At the same time, the extra opportunity, which I have not mentioned, they get extensive experience.
For me, Delaware just has a little bit of everything. I mean, you got beautiful beaches, you have 2 hours to New York City, Philadelphia, you know, lots of things to do, great health care, you know, we have great, you know, hospitals here, and it was really a no-brainer.
Whether you're looking for personal, professional, continuing education and development, we're close to the hub of some of the best Northeast education institutions, and within Delaware, we have some of the best academic settings.
We have patients of all cultures coming to our clinics, and me being bilingual, I'm able to offer the services of translation while I'm there, and it's been great.
Delaware is centrally located, with convenient access to major East Coast cities. And the Delaware Advantage includes a strong economic climate, with a number of financial incentives for practicing in areas designated as high need here in the first state.
Many of us come out of our medical training with enormous loans. And there are a number of different types of opportunities available for loan repayment here in Delaware.
It's a guarantee to get you in a spot for a few years to help take care of people who need it and get a little something back.
Well, after leaving residency, when I was looking for employment, I found out about the National Health Service Corps. I really loved the area. I wanted to stay close by, and I found that Delaware had a good amount of loan repayment locations. There's also the Delaware State Loan Repayment Program, and that actually helped me a lot.
The Delaware State Loan Repayment Program also offers funding opportunities to offset educational debt for mental health professionals in exchange for their commitment to provide services in underserved areas of the state. The J-1 Visa Waiver Program places international graduates who have completed their medical education in the U.S. into full-time practice in underserved areas required for a minimum of 3 years.
So for a beginner J1 candidate, it's an ideal place to establish your career because you get extensive experience here because of the demand.
Delaware is looking for primary care physicians, dentists, mental health professionals, and mid-level health practitioners in all disciplines, with expertise and a commitment to providing high-quality medical services to our growing population.
In the southern parts of our states, we have greater needs for primary care as well as dentists, and a growing amount of opportunities for mid-level providers.
In Sussex County, probably the greatest reward as a clinician is that there's such a diverse population that you get exposure and experience to just about everything.
Clinically, we are the best, I consider, of America in that you can be working in a rural community with immigrant workers. Within a 2-hour drive, you're working with cutting-edge scientists in a hospital setting. We have some of the best federally qualified health centers in the country who really tap into rural vulnerable populations and at-risk challenging populations.
Working in a small, community that's tight-knit, close, you really get to know your patients.
If you really want to help people, and this is a very great opportunity to help. There's a big need in this for this Sussex County, not only Sussex County, for the entire Delaware.
But there's also a lot of great opportunities to collaborate in Delaware with other health professionals, with public health, with policymakers, legislators. So you can change the way things are done in Delaware. You can change the way in which we practice medicine in Delaware.
Hi, I'm Delaware Governor Jack Markell. You've heard many reasons now why Delaware is a great place to live and work. And as governor of the state of Delaware, I'd like to encourage you to learn more about what medical practice opportunities are available for you. Whether you want to practice in a rural area, an urban area, or something in between, you can find what you're looking for right here. Delaware is a great place to practice because it's a state rich in the resources and qualities that can make a difference in both your professional and your personal life. Make Delaware your first choice.